So your type 1 diabetic have an absolute insulin deficiency. So with type 2 diabetes, it's usually a metabolic disorder.
Hello there and welcome to another guest segment of the Breakfast Connect on Africa Business Radio. I am Chukwunonso Modi. Today we are talking about diabetes. Now, World Diabetes Day is marked every year on 14th November, and the 2021 to 2023 global campaign theme is Access to Diabetes Care, if not now, when? Nearly 500 million people are currently living with diabetes worldwide. In South Africa alone, diabetes is the second leading cause of death. In 2019, diabetes alone caused 4.2 million deaths worldwide. However, access to insulin and diabetes care still remains a challenge for many. Joining us to have this discussion is endocrinologist at Arwyp Medical Center. She was previously the head of the clinical unit at Sefako Makgatho University. A mother of two and a sports fanatic. Welcome, Dr. Mampane. It's a pleasure to have you here with us.
Good day. Thank you very much for the invite.
No problem. Now, this particular topic is so dear to me because my grandmother died of diabetes and she had complications that I feel could have been avoided. So for starters, can you briefly tell us about diabetes? How can one get it?
I'm also passionate about diabetes. My dad has diabetes and almost all his maternal as well as paternal cousins also have diabetes.
Okay.
So I'll start by just defining what diabetes is.
Okay.
Diabetes is usually a chronic health condition in which our body is unable to use the energy that we get from food. So in people who have diabetes, they're unable to either produce insulin or the insulin that they have, they're not sensitive to it.
Okay.
So what happens is most people who have diabetes can have long-term complications. So we want to raise awareness because diabetes is usually a silent killer. So if you're not diagnosed, you can develop complications like blindness, you can have a stroke, you can have complications from diabetes affecting your legs, and you develop a neuropathy from it.
Okay. All right. So what are the most common symptoms to look out for in diabetes?
Okay. So it can be asymptomatic.
Okay.
Some can then have what is known as polyuria. So you have an increased thirst and you also have an increased urination. You have an unintentional weight loss. You have chronic fatigue because it affects your nerves. Then you can have sort of pins and needles as well as numbness in your hands as well as your feet.
Okay. I particularly remember that weight loss because my grandma at some point when it got so bad, she did lose a lot of weight. And I was wondering what's going on. This is someone who used to be all fleshy and chubby and now she's really drained. Okay, so there's something I would like to ask. There's a type 1 and type 2 diabetes. What is the difference between both of them?
Okay, so you remember what I said, that you get diabetes because your body is unable to turn the food that you're using into energy.
Yeah.
So your type 1 have what is known as an autoimmune disease.
Okay.
So with that autoimmune, like your body attacks itself. So the body in that case attacks the pancreas, and the pancreas is then unable to produce insulin. So your type 1 diabetic have an absolute insulin deficiency. So with type 2 diabetes, it's usually a metabolic disorder because your grandmother had diabetes, my dad has diabetes. We at risk of developing diabetes because of our family.
Yeah.
We sort of have an increased abdominal girth. Then in that way, because we're genetically predisposed, and we also, if we were to gain weight or have a sort of an increased abdominal girth, you will get to a point where our pancreas will produce insulin, but that will then develop sort of an insulin resistant. We'll be unable to use that insulin. So with your type 2, they have sort of what is known as a relative insulin deficiency.
Okay. You said now that diabetes can be hereditary. That's what you mean?
Yes.
Okay, so for people like me that already have something like that in their bloodline, let me use that word, how can I manage diabetes? How do I make sure that I don't get to a point that it becomes a killer?
Okay, so I think we should raise awareness, especially people who've got risk factors. If you've got a family history, if you had diabetes when you were pregnant, if you are more than 45 and you've got sort of an increased body mass index, you should have regular checkups to screen whether you don't have diabetes or not. The other thing that you can do is to make sure that you exercise at least 30 minutes 5 times a week. You also will lose weight. If you're to lose weight and have reduced abdominal girth, that will also sort of help your body cells to be sensitive to insulin. So that will also just reduce your risk of developing diabetes. The third most important thing that you should do is also to have a diet that is balanced with carbohydrates as well as proteins.
Okay, so for patients that already have diabetes, be it type 1 or type 2, how can they manage it?
Management has to be with your lifestyle, exercising, reducing weight, and also having sort of a balanced diet. And then management also with your type 1 is to make sure that you're compliant on insulin. You take your insulin as prescribed, and also you are able to sort of count the amount of carbohydrates that you're taking, and also to know how much insulin to use in that case.
Okay. So now that you mentioned diet and exercise, now does it mean that if you diet enough, if you exercise, it can reverse diabetes?
Unfortunately, with your type 1, it might not reverse it because remember I told you you've got an autoimmune disease, it's your pancreas. So pancreas is not able to produce insulin in that case. So in that exercise, in that case, you can reduce the amount of insulin that you're using. But if you've got type 2, certainly, if you're exercising, you're able to prevent the complications of diabetes. Okay.
Now, just like cancer has stages, stage 1, stage 2, and the rest, would you say type 1 diabetes and type 2, there is also a stage, like you first get to type 1 before you get to type 2?
No, with type 2, you can get to a pre-diabetes whereby your glucose level are above normal, but are not at a stage where you can say you've got diabetes.
Okay.
So you can have and in that case, you can prevent that patient from developing diabetes if you get them very early.
Okay. Now let's talk about blood sugar now, because that's one important thing for a diabetic patient. What should one's blood sugar be?
Okay, if you're waking up in the morning, ideally our fasting blood sugar is supposed to be less than 7.
Okay.
And then 2 hours at a meal, our sugar levels are supposed to be less than 11. So if you've got a fasting blood sugar that you haven't eaten from 12 midnight and you're waking up with sugars that are more than 7, then you should go certainly and test if you don't have diabetes. And also, if you've got a random blood sugar that is more than 11, that also you should be assessed whether you don't have diabetes.
Okay. Now, let's talk diet now. You mentioned that dieting and exercise is very good for a diabetic patient. So does that mean as a diabetic patient, you should have a specific diet? You're not meant to eat just about anything.
Diet is certainly very important. We usually draw sort of a plate and you divide it half, and then the one half, if you're able to, it should be the salad, and then the other half you have to divide it into half as well. I usually just show them at first that your carbohydrates have to be that 1/4 in your plate, and then your proteins as well be 1/4 in your plate. So if you were to have a sort of a low-fat diet, a diet that is also low in carbohydrates, but you must have carbohydrates that have sort of a low glycemic index so that you're full. It makes you more fuller and you don't overeat.
Okay.
Yes, that will help.
Okay. We've talked about the patients having diabetes now. Let's also look at the medical sector as well. What resources are available to help patients control their diabetes?
Okay, in the medical sector.
Yes, so what resources are available to help patients control their diabetes?
I think one is us raising awareness about diabetes. Them also just not only raising awareness, but also going into the community to sort of screen, especially patients who are at risk of diabetes, the ones that I've said if you are more than 45. if they've got an increased BMI, if they've got a relative that has diabetes. I think mainly just raising awareness, I think.
Okay. All right. So lastly, with diabetes, you said it's from the age of 45 mostly, but these days we've seen...
No.
Okay. Correct.
No, sorry. I didn't say from the age of 45. I said that puts you at risk.
Okay.
You can have... Yes.
Okay.
Yes.
So that means it doesn't have a particular age range. Anybody is at risk of catching diabetes. Okay.
Yes.
All right. Thank you so much for this conversation. It was an amazing one I've had with you, Dr. Mampane.
Thank you for inviting me.
Yes, I hear you're a sports fanatic. What sports do you like?
Tennis. I'm a Serena fan.
Ooh,
and then
nice. Soccer. Okay, that's nice. Yes. I like tennis as well. But then I must confess I'm slacking when it comes to playing.
Me too.
All right. Thank you so much, Dr. Mampane, for joining in.
Thank you.
All right. That was Dr. Mampane, an endocrinologist at Arwyp Medical Center. The Breakfast Connect show is still on. Stay tuned for more.